In today's video, I'll be talking about gout, understanding the causes, triggers, and effective treatment options. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine, expert in rheumatology and in regenerative medicine. In today's content, we'll be talking about gout. Let's start with the basics. Gout is a type of inflammatory arthritis that can affect one joint or multiple joints. In fact, any joint in the body can be affected, although the most commonly affected ones are the toes, ankles, and knees. Gout occurs when high levels of uric acid in the blood cause sharp crystals to form in the joints. These crystals trigger inflammation, leading to the sudden onset of pain, redness, and swelling in the joint. It's important to note that while gout flare-ups are often sudden, the underlying causes develop over time. So what exactly causes gout? The root of the problem lies in uric acid, a byproduct of purine metabolism. Purines are natural substances found in the body, but they're also present in many foods. Normally, uric acid dissolves in the blood and passes out of the body through the kidneys and urine. However, when your body either produces too much uric acid or doesn't eliminate enough of it, the levels build up. Over time, this excess uric acid forms sharp needle-like crystals in the joints, leading to pain and inflammation within the joints. Some people are genetically predisposed to gout, meaning their body either produces more uric acid or their kidneys are not as efficient in eliminating it. This is why some people may be more prone to developing gout, even if they have a healthy lifestyle. Now let's talk about what triggers a gout flare. While high uric acid levels set the stage for gout, certain triggers can spark a flare-up. One of the biggest culprits is diet. Foods that are high in purines, such as red meat, organ meats like liver and certain seafoods, can significantly raise your uric acid levels. Alcohol, especially beer, is another common trigger, as it both increases uric acid production and reduces the body's ability to eliminate it. Sugary drinks and high fructose corn syrup products are also linked to higher uric acid levels. In addition to diet, dehydration can trigger a flare because it reduces your body's ability to flush out uric acid. If your kidneys are impaired, removing uric acid from the blood becomes more difficult, leading to a rise in your blood uric acid level. In addition, stress, illness, and even sudden changes in your weight can also bring on an attack. Understanding these triggers is key to managing gout and preventing future flare-ups. When it comes to managing gout, your diet plays a major role. By avoiding high purine foods, limiting alcohol intake, and staying hydrated, you can significantly reduce the risk of flare-ups. The goal is to keep your uric acid levels in check and to keep it below a level of 6. A level below 6 in your blood uric acid will help prevent you from having flare-ups. First, let's talk about what to avoid. Red meat, organ meats like liver, and certain seafoods such as shellfish are high in purines and can raise uric acid levels. Beer is another major trigger, as it not only contains purines but also affects how your body processes uric acid. Sugary beverages and foods high in fructose like soft drinks and sweets can also increase the risk of gout. Now, what should you eat? You should focus on a diet that is rich in fruits, vegetables, and whole grains. Cherries in particular have been shown to lower uric acid levels and reduce the risk of a flare-up. Low-fat dairy products are a good source of protein without the high purine content. Staying well hydrated is also critical. Drinking water helps flush out excess uric acid through your urine. By making these dietary changes, you can not only prevent gout flare-ups, but also improve your overall health. In general, moderation when it comes to diet is generally a good course of action when it comes to your health. In the case of gout, however, if you're having gout flare-ups on a regular basis, or if you have a collection of crystals called tophi that are in your body as well, I would recommend being more strict with your diet and really limiting the amount of red meat, shellfish, and alcohol that you consume, at least until your uric acid level is under control and your condition is under better control. It's important to understand that gout is not just about joint pain. It's also closely linked to other health issues, especially metabolic syndrome. Metabolic syndrome is a cluster of conditions including high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. These factors, as well as an elevated uric acid level, not only increase your risk of heart disease and diabetes, but also make you more susceptible to gout as well. Gout is often part of a bigger picture. High levels of uric acid in the blood can signal underlying metabolic problems. If you have gout, it's essential to work with your doctor to address any other risk factors for cardiovascular disease, such as obesity, hypertension, or insulin resistance. By managing these conditions through lifestyle changes, medication, and regular monitoring, you can reduce your risk of future gout attacks and improve your overall health. Managing gout effectively involves a combination of lifestyle changes and frequently medication as well. For many people, medications such as allopurinol, febuxostat, or Krystexxa are used to lower your uric acid levels and prevent flare-ups. These medications can be used long-term. During a flare-up, anti-inflammatory medications like NSAIDs or colchicine or even steroids can short-term help to reduce pain and swelling. It's important to keep in mind that these medications, however, should only be used short-term. So who should actually be on medication? Well, if you have a very high level of uric acid level, diet may not be adequate. In addition, if you have any signs of chronic damage from gout, whether that would be damage to the bone, such as erosions, or chronic collection of gouty crystals, such as tophi, I would recommend being on medication in those cases. In addition, if you're having frequent flare-ups, despite dietary and lifestyle changes, starting medication for gout would be recommended as well. Gout may be painful, but with the right approach, it's manageable. By understanding what causes it, recognizing the triggers, and making healthy lifestyle choices, you can prevent future attacks and maintain a high quality of life. If you're dealing with gout, don't hesitate to reach out to a healthcare professional to develop a personalized treatment plan. Thank you for your time today. If you found this content helpful, give us a like and subscribe to our channel. Until we connect again, have a good day and live well. Bye-bye.